Hi everyone. This video is the sternocleidomastoid muscle. As the name suggests, this muscle attaches to the sternum, the clavicle, and the mastoid process of the temporal bone. So we have sternocleidomastoid. This muscle is on page 244. Here we are, sternocleidomastoid. This muscle you are probably already familiar with just because it's so big. You can see it really easily, and we've kind of used it as a landmark before. Sternocleidomastoid. You can see it right here. Anytime you rotate your head from one side to the other, you can see sternocleidomastoid. It is entirely superficial and easily palpable. All right, so there it is. Interesting fact about sternocleidomastoid, or SCM, as it is abbreviated. When you are forming in utero, the sternocleidomastoid and the trapezius are actually one whole muscle. And you can kind of see this when you take a look at the attachments here and here. The attachment of trapezius goes all the way across the nuchal line and then becomes continuous with the attachment of SCM. So it makes one continuous line across the back of the head and base of the skull here. Now, of course, when you're developing then, the sternocleidomastoid and trapezius separate, and then the actions are different. But actually, in some people, it doesn't separate fully, and they tend to have a bit of an issue with range of motion with their neck. It's not very common, though, just a fun fact. So sternocleidomastoid has the origin and the insertion in the name. So let's talk about that, okay? We have the sternal head, and we have the clavicular head, and they do have separate attachment points, but it's really difficult to feel the separate attachment points. You can see them, but they feel like one continuous piece here, okay? So the sternal head, of course, is right there, okay? The clavicular head is just next to it. And if we're talking specifics, the sternal head is actually the top of the manubrium of the sternum here. And the clavicular head is the medial 1/3 of the clavicle. Medial 1/3 of the clavicle. The insertion is the mastoid process of the temporal bone. Of course it is. And the lateral portion of the superior nuchal line. I just mentioned its relationship to trapezius, so that should be no surprise. Now, as far as the actions are concerned, well, we can see the actions pretty much all the time. We can see them every time we turn our head from one side to the other. So that is an action. Unilaterally, we rotate the head and neck to the opposite side. So this is a contralateral rotator, just like trapezius. That's right. It's a contralateral rotator. Rotates the head and neck to the opposite side. It can also laterally flex the head and neck. See? Right there, laterally flexing. Okay. So we have lateral flexion and rotation to the opposite side, and you can see very easily that that muscle pops right out when we do that. Bilaterally, these are on the anterior, so they're going to do anterior type things like flexion. So we have flexion of the neck. Now, because it does attach to the sternum, it can assist to elevate the rib cage via the sternum, lifting everything up during inhalation. In fact, if I breathe in really hard, you can see my SCMs. They do engage as they're trying to move everything into elevation during that inhalation. Now, SCM is innervated by spinal nerves, okay? Spinal nerves and C2 and C3. So we haven't talked about spinal nerves at all. We will mention those when we get to the nervous system in physiology. Long story short, spinal accessory nerves or spinal nerves are part of the cranial nerves, and they don't exit in between the vertebrae, they exit at the base of the skull, okay? So it's just a different place of origin for these nerves. So turning your head and brooding engages SCM. This is a silly book, but I love it, okay? And that's it for sternocleidomastoid. Like I said, easy to see, very large muscle here. The only thing that we need to be careful of when palpating this is you do have a couple of veins that are going to cross over superficially on SCM. Sometimes you can see them. You can see that one right there, maybe. Sometimes you can see them, sometimes you can't. It doesn't really matter. With veins, you can't feel a pulse. So you're going to have to try to visually inspect that area so you're not putting direct pressure right on the vein. A lot of times you can see them on people. Actually, you can see mine right there. Okay. Because they're so superficial, they're usually visible. But again, you're not going to be putting that much pressure in this area because it is anterior neck. So you don't really have to worry about that so much. Okay. Have a nice day.